Monday, May 4, 2026, AGNDD Intel report topic. Cruise ship at center of suspected deadly hantavirus outbreak refused permission to dock. Please pardon any visual and informational inaccuracies in this partially AI-generated article-based video. Cruise ship at center of suspected deadly hantavirus outbreak refused permission to dock. The cruise operator said the ship may sail from Cape Verde to Las Palmas or Tenerife in the Canary Islands and dock there. NBC News, May 4, 2026, 8:57 a.m. EDT, updated May 4, 2026, 3:54 p.m. EDT, by Patrick Smith. The cruise ship at the center of a deadly outbreak of hantavirus has been refused permission to dock, with 149 people still on board, 2 of them seriously ill. The virus is suspected to have killed 3 passengers and sickened 3 more, with 1 patient hospitalized in critical condition. The World Health Organization said Monday that the ongoing risk to the general public from the disease, which is rare in humans and not easily transmitted, was low and there was no need for panic. The remaining passengers, who are from 23 different countries, including 17 Americans, are required to follow strict precautionary measures, including isolation and medical monitoring, the cruise operator said. The West African nation of Cape Verde said it had decided not to let the cruise ship, the Hondius, dock at the port of Praia as a precautionary measure, Reuters reported. The cruise operator, Ocean-Wide Expeditions, earlier Monday had said in a statement that the ship may sail from Cape Verde to Las Palmas or Tenerife in the Canary Islands and dock there. The Hondius left Argentina for the Canary Islands, the Spanish-controlled islands off the west coast of Africa, about 3 weeks ago, with around 150 passengers. One person, a British national, is in an intensive care unit in Johannesburg, South Africa, that country's health ministry said in a statement. It said that the unidentified patient was in critical condition. 2 crew members, 1 British and 1 Dutch, were ill and required urgent medical care on board the Hondius, the cruise operator said. The WHO said it was assisting in planning the medical evacuation of these patients, and an official from Cape Verde said an air ambulance was being prepared and would be used if needed. Ocean-Wide said Sunday night that local health officials had been aboard to assess the 2 symptomatic people but were yet to make a decision regarding the transfer of these individuals into medical care in Cape Verde. The WHO stressed that there was no need for alarm. The risk to the wider public remains low. There is no need for panic or travel restrictions, WHO Regional Director for Europe, Dr. Hans-Henri P. Kluge, said in a statement Monday. We are acting with urgency to support the response to the hantavirus event on board a cruise vessel in the Atlantic, following the tragic loss of life, he added. Kluge said he was in contact with authorities in Europe and South Africa to ensure a science-based response. The statement from Kluge also said that hantavirus infections can be severe in some cases, if not easily transmitted between people. A State Department spokesperson said on Monday that the U.S. government was closely watching the situation and stood ready to provide consular assistance. It remains unclear how passengers on the Hondius came to be infected, but Kluge said infections are usually linked to exposure to infected rodents. 2 of the deceased victims were a married couple. A 70-year-old man who died on board on April 11th and was declared dead on arrival to the remote Atlantic island of St. Helena on April 24th, and a 69-year-old woman who collapsed at Johannesburg's International Airport while attempting to fly back to the couple's native Netherlands. Ocean-Wide said the 3rd victim to die was a German national, although the official cause of death is not known. Germany's foreign ministry later confirmed that person's death. Maria van Kerkhove, who's Epidemic and Pandemic Preparedness and Prevention Director, said Monday that the organization is helping to evacuate the 2 sick patients remaining on board to the Netherlands. None of the other 150 or so people on board are currently showing signs of illness, she said, but they were advised to stay in their cabins while crew members work to disinfect the ship. Meanwhile, Health officials are working to figure out how this happened in the first place. We are working with authorities to understand the source of exposure through epidemiological investigations and doing contact tracing to identify any further cases. Laboratory tests are also ongoing, Van Kerkhove said. Kluge said the incident was an example of the need for international collaboration on health. Having just returned from the African continent, where I discussed closer collaboration on health emergencies, this is a timely reminder. Health threats do not respect borders. Working together is how we protect people, Kluge said. President Donald Trump in January terminated U.S. membership of the WHO, citing alleged failures during the COVID-19 pandemic. Hantavirus made headlines last year when a medical investigator confirmed it killed Betsy Arakawa, the wife of actor Gene Hackman, at the age of 65. Patrick Smith is a London-based editor and reporter for NBC News Digital. Reuters, Camille Benke, Erica Edwards, and Patrick Martin contributed.
Thank you for watching this AGNDD Intelli Report, dear viewers. Please like, subscribe, and click the bell button to get notified during new uploads. And make sure to tune in next time. Stay safe and healthy. Cheers.